Did you know that millions of people are living with diabetes and don't even know it? Early detection can make a huge difference, so stick around as we walk you through 10 early signs that might mean it's time to check in with your doctor. 1. Frequent urination, polyuria. Polyuria, frequent urination, is an early indication of diabetes. Extremely high blood sugar causes this symptom. Normal kidney function filters blood and reabsorbs glucose to prevent urine loss. When blood sugar levels rise above a specific threshold, the kidneys struggle to cope with glucose. The glucose leaks into the urine, and the body draws water from the bloodstream to dilute it. This extra fluid causes the bladder to fill faster, causing frequent urination. You may need the restroom more regularly, even at night, disrupting your sleep. This persistent need to urinate at night, called nocturia, can be tiresome and dehydrate you despite drinking lots of water. It's mild, but if it affects your daily routine or sleep, it should be taken seriously. Urinating frequently is bothersome and can cause dehydration, dry mouth, and skin irritation. If you're making more restroom trips, especially if it's unusual or persistent, don't dismiss it. Chronically, high blood sugar might damage your kidneys and trigger more serious issues. Consult a doctor to have the testing needed to diagnose diabetes or another condition. 2. Extreme thirst, polydipsia. Polydipsia, excessive thirst, is another early indication of diabetes. It's linked to frequent urination, polyuria, because the body tries to compensate for fluid loss by increasing thirst. When glucose levels rise in diabetes, the kidneys filter and excrete excess sugar through urine. This constant loss of water dehydrates the body. Even after drinking a lot of water, you may feel thirsty. Dehydration occurs despite your best efforts to quench your thirst because your body loses fluids. Even after drinking a lot of water, your mouth may stay dry and you may feel thirsty all day. Polydipsia is more obvious when you drink more water than normal. In severe situations, excessive thirst may require regular drinking, carrying a water bottle, or drinking throughout the day. This thirst may cause dry mouth, chapped lips, and throat dryness. The continual fluid intake and loss cycle can cause dizziness, disorientation, and fast heart rate if left unchecked. Polydipsia is caused by blood sugar management issues, not a lack of fluid consumption. If you drink more water than normal and still feel thirsty, especially with frequent urination, you may have diabetes. If you observe these symptoms, see a doctor to avert more serious issues. 3. Increased hunger, polyphagia. Polyphagia, increased hunger, is another early indication of diabetes. This isn't just hunger from skipping a meal or eating too little. Polyphagia causes unquenchable desire after eating. If you're often hungry, even after meals, your glucose metabolism may be awry. Diabetes occurs because the body can't properly use glucose, the cell's main energy source. After eating, your body converts carbs into glucose, which enters your circulation. The pancreas produces insulin to transport glucose from the bloodstream into cells for energy. Diabetes occurs when the body doesn't create enough insulin, type 1, or when cells become insulin resistant, type 2. Therefore, glucose stays in the bloodstream rather than entering cells. Your body thinks it's starving because glucose doesn't fuel your cells. It compensates by delivering hunger signals to your brain, making you consume more for energy. This is why you may feel hungry after a meal. Extreme examples may involve eating enormous meals or nibbling continuously, yet still not feeling full or invigorated. Diabetes often causes accidental weight loss and increased hunger, which can lead to overeating. Despite consuming more, your body can't turn it into energy, causing persistent hunger and exhaustion. Eating more may worsen blood sugar levels. If you have persistent hunger, frequent urination, excessive thirst, or unexplained weight loss, visit a doctor. Diabetes-related hunger is a symptom that your body is struggling to manage its blood sugar levels, and early diagnosis can avert consequences. 4. Unexplained weight loss. Unexpected weight loss is another indicator of diabetes that may confuse you. Increased hunger may indicate weight gain. This symptom is worrisome because it occurs without diet or exercise changes. If you're losing weight quickly despite eating more or staying the same, your body may be having trouble managing its blood sugar. Diabetes prevents the body from using glucose from food. Insulin normally transports glucose into cells for energy. However, glucose persists in the bloodstream when insulin is not generated, type 1 diabetes, or when cells develop resistant to it, type 2 diabetes. Even though you're eating plenty, your body is starving for fuel. Your body seeks other energy sources. It breaks down fat and muscle to get energy. This causes rapid, unintended weight loss. Some folks lose several pounds quickly without trying. Even if they eat more, people can lose weight because their bodies couldn't use the calories. Unexpected weight loss in diabetes generally causes fatigue, frequent urination, and thirst. Inability to correctly use glucose can cause energy deficits, leaving you weak and fatigued and losing weight. This condition might cause muscular loss and immune system weakness if it persists. Be concerned if you lose a lot of weight without changing your food, activity, or lifestyle. Ignoring this early indicator of diabetes could exacerbate the condition and cause more health issues. A doctor can evaluate your symptoms and run tests to see if diabetes is causing your unexplained weight loss. Early diagnosis and therapy are essential for treating and preventing physical damage. 5. Fatigue and weakness. Diabetics often experience fatigue and weakness, which can affect daily life. If you feel weary after a good night's sleep, your body may be having trouble managing glucose. Insulin helps glucose from food enter cells in a healthy system. Since glucose is the cell's main energy source, you stay active and attentive. Diabetes keeps glucose in the bloodstream rather than in cells due to insulin resistance, or insufficient insulin synthesis, type 1 and type 2. This depletes cellular energy. You may become persistently tired and feeble. This continual tiredness is unpleasant since your body is not using the energy from food, despite eating enough and resting enough. Lack of glucose in your cells causes fatigue and weakness, making even simple tasks like going to work, exercising, and doing chores seem overwhelming. Life quality can also be affected by prolonged weariness. Lack of motivation, concentration issues, and general malaise may occur. Your mood, productivity, and well-being may suffer. Fatigue and weakness can impair everyday chores and quality of life in extreme cases. If you're feeling tired and weak and have other symptoms like frequent urination, excessive thirst, or unexplained weight loss, see a doctor. When combined, these symptoms may indicate diabetes or poorly regulated blood sugar. Early diagnosis and treatment are essential for treating diabetes and preventing consequences from high blood sugar. 6. Blurred vision. High blood sugar levels can affect various parts of the body, including your eyes. You might experience blurred vision as the lens of the eye swells due to fluctuating blood sugar levels. This swelling affects your ability to focus and can make your vision appear blurry. If you find yourself struggling with your eyesight for no apparent reason, and it comes and goes frequently, it could be tied to changes in blood sugar. 7. Slow healing of cuts and bruises. Have you noticed that cuts, bruises, or even minor injuries are taking longer to heal than usual? High blood sugar impairs the body's natural healing process. This happens because elevated glucose levels can affect blood circulation and damage your nerves, making it harder for blood and nutrients to reach the affected areas. If your scrapes or bruises seem to linger, it could be an early sign of diabetes. 8. Tingling or numbness in hands and feet. Tingling, numbness, or a pins and needles sensation in your hands or feet can also signal diabetes. This happens because prolonged high blood sugar levels can lead to nerve damage, known as diabetic neuropathy. Over time, the damage can worsen, leading to a more intense sensation or even pain in the extremities. If you experience these symptoms regularly, it's worth considering whether they could be related to diabetes. 9. Skin issues. Skin problems are another often overlooked sign of diabetes. You may notice dry, itchy skin or dark patches, particularly around the neck or armpits. This condition, known as acanthosis nigricans, can indicate insulin resistance. Other skin conditions like frequent infections or skin tags might also occur. If your skin feels off or is acting unusually, it could be a subtle but important sign that your blood sugar levels are too high. 10. Frequent infections. If you're getting sick more often than usual, or dealing with recurring infections like bladder infections, yeast infections, or even gum disease, this can be linked to diabetes. High blood sugar weakens the immune system, making it harder for your body to fight off infections. Frequent infections or slower recovery from common illnesses can be a sign that something deeper is going on with your blood sugar control. So, those are 10 common signs that you may have diabetes. If you're experiencing any of these symptoms, don't panic, but do check in with your doctor to be sure. Early detection can truly make all the difference. Thanks for watching. If you found this video helpful, make sure to hit that like button, subscribe, and turn on notifications so you never miss an update. Stay healthy, and I'll see you in the next video.